Okay, we back. You had. We're back, Jazz.
Okay.
Dr. Jazz. You had it.
I did have a question,
Uh-huh.
but it was more so on a whole nother topic. Like, so I wanted to know, like, on the aspect of how one's dreams correlate with like their reality. Like, do they coincide? Like, has that ever been a subject that you had to touch on?
You mean from a mental health standpoint?
Yes.
Dream analysis is a whole separate thing where I don't do dream analysis. You have
Okay.
to be trained in order to analyze someone's dreams. So, um, all I know about dreams is they're images that you somewhat collected, especially faces. Like your brain won't make up a face; it'll use faces that you have already in memory, but it creates stories based on different things. But I'm not a I don't analyze dreams.
Okay. So, some way or another, they basically do.
Yeah.
So with the you say you deal with a lot of clients with the cheating and
With the cheating.
well,
With
not
the
cheating,
cheating.
Well,
but you know
not
that
a lot of my clients are
not
coming in for cheating, but that's one of the things that
the
someone might
heartbreak,
come in for.
the heartbreak.
Whether it's breaking up, cheating, yeah.
You're just trying to
Okay.
cope with the loss afterwards.
The loss of it.
I mean, grief, right? When you think
Mhm.
about grief, you usually think of
hmm
somebody dying, but like the loss of a relationship, the loss of a job, like the loss of security, like it's all grief. So a lot of times when people seek therapy after that, it has like, it's that feeling of grief. Like, oh, this relationship that you just invested so much time in and all that fun
Not
stuff.
even not even just the time that you invested in the relationship can cause you issues, but your fantasy about what was going to happen in the future. So every
Mm-hmm.
day we're thinking future, like what will we be doing, who will be involved, and so all those dreams in the sense that you had of what you and that person would be doing together, what your life would be like,
Mm-hmm.
you're also mourning those things as
Right.
well.
You got to rewrite the whole.
Do
Your
you,
life.
do
Basically, if
you
they're your significant other and they were integrated into your daily everything and you
Mm-hmm.
had a future plan with them, most likely you're now you're replanning and reevaluating your
Your
life.
whole life, yeah.
Mm-hmm.
Is it harder now for y'all to because y'all deal with this? Is it hard to date?
No,
Okay.
it's
No,
hard for people to
yeah,
date me.
it's not hard to date. Um, in what sense? Like, yeah, I think
Like
we go through the same things that any other woman would go through that has
Mm-hmm.
that's women in general, a woman that's educated, a woman that has certain goals. So we go through the same things that anybody else would go through. Like I don't sit there and analyze. I don't
that
psychoanalyze
was
my
gonna
But
be my
dating.
next
everybody
question.
swears
yeah,
we
that's what
do.
I
My
mean.
next
That's why I said
Yeah,
it's hard for people to date me because they
no,
always feel like, oh, here you go. You're going to try to
Yeah,
tell
that's
me
what
about
I'm
my
yeah.
childhood. Ain't
right.
nobody thinking about your
I,
childhood.
I tell them I get paid to do that. You about to pay me?
Right. Right. When I'm not a therapist, I am not a
See,
therapist,
I thought
okay?
it
I don't
might
be
I
doing
thought it
therapy all
might
day
kick
long.
in though automatically. Like,
It's
well,
not like
maybe
that.
in your youth.
Well,
It's
everyone's
not
like, why
like
are you
that.
so scared? What's wrong with you? Like,
They be
we
mad
can really
nervous.
find
Like,
out.
no, it don't. People assume that that's how we operate, but it really is
Right.
like it's really nothing like that. It just don't work like that. I don't
I
know
feel
how to
like if I
explain it.
had the knowledge to
Yeah, I think I
go
would
to
be
But
that
you
house
out.
all
guys
the
do
time,
have the knowledge. You guys have this.
I
It's
think that people don't understand that the way we assess therapy, the way that we assess people in therapy is very different than I'm sure it informs us. I'm not going to say that it doesn't inform us on a daily basis when we're interacting with people, because of course it does.
mhm,
Because we've learned things about people. We've learned,
on a
but
deeper level.
I think
Yeah.
the way that you assess a person for therapy is different than the way that you meet people in a social setting and you're having social
mhm,
personal experiences with them. It's not the same. And that's
right,
why you can't be a therapist to someone that you know personally. It
right,
doesn't work
Oh,
that way.
right,
When we're assessing someone in therapy, we're trained to do it in a specific way to get certain information from
right.
that person.
oh,
It's a very it's we use our what's called clinical judgment, but we also use standardized assessment. But
Right.
Mhm.
we're not really really in there just talking to people like, "Hey, you got depression." It's not like that.
Mm-hmm.
Mhm.
Like we're very careful in the way that we assess and diagnose people. So when we're out having fun,
Mhm.
talking and playing around, flirting or whatever, I'm not assessing you for disorders. Like that takes concentration. That takes, you should do that carefully. You shouldn't just
Right.
go around,
I think I
diagnosing
would do that.
people.
But
I
it's not.
think I would
But
too.
it's not to
Like,
say that
I
when
really do.
people
Like,
we know are like,
I would.
there.
I don't feel like I would be out there like, oh, you're depressed. Like you got
No,
shit going on with you that you don't even know.
Yeah.
Like you, I like,
I
but
just think it would come out.
for like,
it does. Like there have been times where I have friends or associates or whatever where I'll be like, oh, he narcissistic as shit. Like I
Yeah.
know one when I see one, and
Yes.
that's one. But I don't go up to him and say that shit.
Mhm.
And we're
Unless
not
he
looking
asks.
for it. Yeah.
But there's certain things that people do, but that has to be something. It has to be something major that you did. Like just because you like when it comes to like if you talk about a personality disorder, right? Just because you like all of us have done something personality disorder ish at some point in time in our life. You have to have like they give you a list of qualities or a list of
Traits.
traits that you would have to have in order to fit this diagnosis, and you would have to have those traits over 6 months period of time before you can be like, okay, this is what you have. Just because you did it once or twice or 3 times in your lifetime doesn't mean that you suffer from that. But if it's been 5 out of the 10 for the last 6 months, then you might have a problem. You know what I mean?
Oh,
So it's
yeah.
not
Yes.
it's not
And
something I can
also,
see somebody once and be like, oh, he must be XYZ. No.
oh, okay.
to add on to that, all personality disorders are based on traits that everyone has in
Hmm.
their it's traits that people have in general.
Right.
It's just that you have a certain amount, or you have
Like
certain ones in a
excessiveness.
cluster, or that affect your functioning in a
Right.
certain way. Not to say that everybody's narcissistic, but it's on a scale.
Mhm.
Right.
It's on, you understand, like
It's
we
not a
all have these
problem
traits
until it's a
to a
problem.
different degree, and then when they're a certain degree, that's when it will be considered a
Hmm.
personality disorder.
It has to affect your daily functioning in some way, shape, or form for it to be like, all right, this is an issue. You need to get help. Like depression, like all of us are going to experience depression at some point in our lives. But if it comes to a point where it affects your daily functioning, where you can't do the normal day-to-day stuff, you can't go to work, you can't maintain relationships with people, you're not taking showers, you're not eating, you're not sleeping, like when it starts to affect your daily functioning, that's when it's like, all right, you need to get help.
Mhm.
But other than that, like, if you got low mood or whatever, like that can last for a couple weeks. But if it's going on a couple months, you might want to get some help before it gets worse.
Mhm.
Because depression has a way of getting worse and growing legs and running away from you. And then you can't catch it.
You catch it back.
You can't catch
And
it.
that's pretty much mental health disorders in general, and that's
Hmm.
why it's like important for preventative measures. Like
Yeah.
don't wait until things are at their worst to say, you know what, let me go see somebody because I feel like I'm going to hurt myself. You
Hmm.
should actually go see someone way
Way
before
before
that,
that.
and so it doesn't get to that point.
Mhm.
Whatever you're going through, if you feel like something is bothering you and has persistently been bothering you, we like to wait. Like that's the same thing when people come in for relationship counseling. They like to wait until that thing is like
It's
broke
over.
down, like it's been broken for years, and then they come
Then
in
it's
and
been
want
done.
2 sessions to fix the problem. No, no, no. You've been together for 10 years, torturing each other for 8, and you want me to fix you in two
In two
sessions, and it
sessions.
doesn't work that way. Yeah.
Mhm.
So you for anything that any kind of problem is, we always want to think about preventative measures. If you're suicidal, yes, you should get help, but everybody should go before that.
Hmm.
Okay.
I feel like I've heard a lot about them people saying that mental health issues can be like hereditary. Like, how often have you seen situations, or how accurate is that information?
It's very accurate. It doesn't mean that you'll have it 100%, but the likelihood that you could have, like if you have a grandmother who has schizophrenia and then you have depression, well, that's not unlikely.
Hmm.
So the probability of you having a mental health disorder when someone else has a mental health disorder in your family is higher,
Hmm.
just like
Mhm.
alcoholism or
Hmm.
other issues. So yes, that's true. That if it can be hereditary. It doesn't mean 100% that you'll have a disorder just because someone in your family does, but it increases the probability of
Hmm.
it happening.
Mhm.
And schizophrenia tends to lay dormant too. It's like usually triggered by some type of trauma. So you could have it and like Ben had that, that gene for it, but most of the time it takes some type of trauma to trigger it. It could be bad weed, it could be any, like, just something little, and next thing you know, it's like you never had an issue your whole life, and all of a sudden you schizophrenic.
It doesn't even have to be bad weed. It could just be
Any weed.
weed. Yeah.
It can really, because some, like, you ever heard some people get high and they be like, oh, it makes me paranoid, or it makes you what, but paranoia is a part of schizophrenia, or one type of it. So it's like certain drugs. Like I had a client when I was doing the group home. He was fine. Like all of them were fine. This one got drugged at a party, and he's like can't do anything. He can't even talk.
Oh wow.
All because he got drugged at a college party. He was in college. My other client, he was in college too. He'll tell you political science at NYU, and he had so much electric shock therapy, which was really a thing, that his brain is fried. His brain is fried. He literally has all these different personalities in his head. He talks to all of them, and they got different accents and everything. It was crazy.
Wow, that's crazy.
And one of my clients seen her dad kill her mom, and she been crazy ever since. Like they're fine. They're fine their whole life. They go through some type of trauma, and then they're just fucked up forever, and it's crazy.
Well, but how can you help people like that?
You can't.
Oh, okay.
So that's what I'm saying. Like that's the population that I was
How do you
working
help
in.
people like what?
You kind of keep them at their baseline.
How you? Oh,
Kind of what she was saying earlier. Like I can't
okay.
hope that they get to my functioning. The only thing I can do is get them to a level where they're functioning daily. They're living every day. They're eating every day. They're still some joys of life, but they're never going to be like me again. I can't have that. Right. I can't have that goal for them because it's not going to happen.
So that's the difference with mental health, is you can get them back.
It depends on how severe it is.
Oh.
It's like she was saying with levels.
Oh, okay.
Everyone, I think, can be helped to a degree. It just depends on what their issue is and how they're functioning and how they were functioning before. So it's a bunch of different factors that play a part. Your support system, intelligence, your motivation to do certain things. So depending on what the problem is or what the issue is, that would determine what the expectation or what the prognosis is. Basically, how do we think you're going to do in the future? How well do we think that you're going to get?
Do you deal with postpartum depression?
Yeah, postpartum depression.
That's a real.
Can we touch on that? Because I had postpartum depression for like 4 years.
Wow.
Yeah, I think
Did you ever try to get help with it?
No.
Did you know what it was?
Yeah, I did know what it was, but I didn't. I started realizing that like I really was struggling with it. I did. I kind of seek help, but not, I guess, to the degree. But I think I just got out of it last year.
Okay.
Because actually doing the podcast, it kind of brought my, I guess, therapy. I don't know.
Okay.
But I did suffer with it for a long time.
And that sounds almost like it was postpartum depression, but it went into just a
depression.
Depression.
Yeah.
Because usually postpartum depression doesn't last for 4 years.
I think I did. Yeah, it started with but then I had. So I had my son, and I had postpartum for a year. Then I had my daughter. I was getting back on track. Then I got pregnant and had her. So after having her, that's when I fell back into it. So it's kind of like it was a in and out type of thing. But postpartum until where I didn't even go outside. Like I didn't do nothing. I was just,
it's a real depression.
Yeah. But people don't
It's
understand.
triggered by having a baby, but it's depression.
Depression at all.
Yeah.
Did you suffer with it?
I'm sorry.
It's not.
Did Nakia have that?
No.
Oh,
Green Eyes has a kid.
Yeah, I do.
Oh, you have two? Oh,
Yeah.
she has.
I feel like no, not really. I mean, I did like I may have like had my days, but like I can't say that I fell into a full slump. I don't know. It would be more like
no.
Yeah. It was more like a personal depression than the postpartum. Like that was like my limelight. My kids. Like I had happy pregnancies.
I was good in the pregnancy till afterwards. It was like, boom. Yeah. And it wasn't the point, because I knew a lady who said she went through postpartum depression, but she thought people were gonna kidnap her child. So
That sounds
So
more
that
like
sounds like more than postpartum
yeah.
depression. It actually something else could have been triggered.
Mm-hmm.
oh,
Another
okay.
mental
Because she
health
had some
issues. Not to
psychosis.
say that she wasn't didn't
Maybe
have,
she
because you
was
can have more than
something
one
going on in her
disorder
childhood or
at a
something.
time. But that sounds like it went into another area.
Oh, okay. Yeah, because she used to say that nobody could watch her kid. She thought somebody was gonna kidnap. Like,
Yeah.
That's paranoia,
Yeah, it
and
sounds like
so
psychosis.
yeah,
oh, that's something different than
Mm-hmm.
the
yes,
postpartum.
then depression. Yeah,
What would
usually
you?
people with postpartum depression are not paranoid.
Oh,
That's
okay.
not. That's one of the symptoms.
What's one of the traits for postpartum?
It's usually so it's a depression, but it's tied to giving birth or after birth for a certain period of time, and so it's the other symptoms of depression, like a sense of hopelessness. It could be irritability, it could be insomnia or hypersomnia, it could be overeating or not or loss of appetite, or losing weight. So there's just regular symptoms of depression, but what makes it postpartum is that it's tied to you giving birth
Mm-hmm.
Mm-hmm.
and for a certain amount of time after giving birth. So you can have this like a sense of hopelessness. And I think one of the features of it being postpartum is that there's this disconnected feeling from the child. Like where, people say, oh, when the baby was born, they felt this bond or connection.
Mm-hmm.
Sometimes with postpartum depression, moms don't feel that.
Mm-hmm.
And that bothers them. That really bothers them, that they feel like they're not as connected to their baby as they thought they would be.
Mm-hmm. Mm-hmm.
And that goes away. But
And,
just that, I mean, imagine being a mom. That's got to be scary to feel like, oh, that this baby has been inside me all this time. And when it comes
Mm-hmm.
out, I think I'm going to feel like XYZ. And then
Mm-hmm.
the baby
yeah.
You
comes out
don't.
and you don't really even feel that attached to it like you thought you would. Not that you don't feel attached at all,
Mm-hmm.
but you don't feel that connection that you thought you would feel.
Mm-hmm.
And then that concerns you, like, why am I not feeling the connection of a mother?
Yeah.
So that's scary. That's one of the scariest things for them, and they feel really guilty about that.
All right. Now, being both of you guys being therapists and psychologists, have you been through depression?
Um. Okay, so it it depends on. It's always weird for me to talk about depression because it's like the depression and like the common vernacular, like how people see it, and then it's
The
my clinic,
diagnosis.
right? My clinical knowledge of what depression is. So
Uh-huh.
based on the clinical knowledge of what I know depression is, like having that low mood that lasts for 6 months or longer, no. But I've definitely been, sad. I've been sad for weeks, or, just
Mm-hmm.
felt like, having those moments where all you want to do is sleep and not having no energy and not having no motivation. And you know what I mean? When I get really sad, that's usually I've never had it where I'm eating all the time or not eating, but I've had it to where I want to sleep all the time, or I want to isolate, or I don't feel like talking to nobody. I don't want to be bothered with nobody. I'm not motivated to do anything. I don't have energy, but it's never lasted months.
Mm-hmm.
The longest it's probably last would be like maybe a week or two.
Okay.
But I think the only difference I would say between me and like somebody who wasn't a therapist is my coping skills. I can like recognize stuff and get out of it quicker than other people. The way I think about things might be a little bit different because like I'm constantly teaching coping skills every day.
So
So the
you
same
know.
things I'm teaching people are the same things I'm telling myself. Like, all right, hold on, wait, let me think about this. Like I'm always that person. I'm a cognitive behavioral therapist. So I'm always connecting like how I'm thinking about things to how I'm behaving. So that's like the only difference. Like I got the same issues. I got some bullshit with me too. Like everybody
Mm-hmm.
be like, "How you a therapist?" And you think I've got problems? I got problems.
Yeah.
Just because I know what I'm doing, everybody else don't know what they're doing. Everybody else is crazy, just like I'm crazy. So,
Mm-hmm. Yeah.
but I just cope with things a little. I might have better coping skills than some people.
You think because you went to school for it? Do you think
Absolutely,
you
because I
think if
went
you
to
didn't go
school
to school
for it.
for it, you probably would have felt?
Hell yeah.
Okay.
If I didn't go to school, and then like we were talking about Pisces earlier, and you were saying like, they have trust issues, and
Mm-hmm.
Pisces are known to be emotional and super sensitive and all of those things. And
Super
I
sensitive.
was all of those things until I went to school. And now I just look at things differently. So all those Pisces traits that are so common, like I know them because I was that for so long. But going through the therapy program, and then, when you go through a therapy program, you got to get your own therapist. And then when you are getting your license, you got to get supervised by another therapist. So that's kind of like your own therapy.
Oh,
And
okay.
just having all of those things just kind of made me way less sensitive. Um, so that's the only reason why I'm like a Pisces who's not sensitive. I don't have the same trust issues because, like, to me, I just, I think trust issues is just such a huge problem in our culture. Like, everybody has trust issues.
Mhm.
And so I just kind of make it a point to, you know, like, if you do something that shows me that I don't trust you, then I won't trust you. If you don't, then I don't have a problem with you. Like, I'm not one of those I don't trust anybody people
Mhm.
like other Pisces might
Yeah.
be, you know, because Pisces are so vulnerable. So they have their guard up because they know
Yeah.
once they let you in, like,
If it,
you
yeah.
control so much of their emotions. Their emotions are so intense.
Mhm.
So that's why
Yep.
their trust issues are deeper than other people.
Mhm.
But the only reason I'm not like that is because of the program.
Right. How about you, Jeff?
I've never been depressed. I think I've always had pretty good coping skills. I realized I called it resilience, which I think I've always been pretty resilient to whatever I don't think that the circumstances ever really get to me. Like I'm positive thinking, and I've always been positive thinking, and I've always had the attitude that no matter how bad things are, it'll be okay. And I
Mhm.
think that also just comes from having a family that bounces back from things.
Oh,
So
okay.
you get to see in real time, like, yeah, things are bad,
Mm.
but we're fine, and we just keep going.
Mhm.
But the only thing I can say I've experienced close to something that made me, I got anxiety, not clinical anxiety, but my anxiety went up when I was in grad school in a way
Mm.
that it kind of changed how I do things, and I realized it changed how I am as a person in the sense that uh, the demands that you have in grad school, or at least in my program, they're so ridiculous. Like, there's no way that a person can get done the amount of things that they give you to get done in the time that you have. Like, even if you never slept, you would never get it done. So you're sleep deprived. You're not eating right because you don't have time to organize things that you would like to do, and there's constant demands and deadlines on you.
Mm-hmm.
Mhm.
And so you don't really have time to take care of yourself the way that you would like to. And so I was waking up in the middle of the night, panicked, thinking that I forgot to turn something in. I didn't. It was just the energy of the school, and it was a constant threat. Like, if you don't do this, you'll be out the program. Like, always being threatened and things like that. Where it's like, you can't. Like, I've been working so hard on this, I'm not gonna let anybody take this from me.
Mhm.
So I started to get anxious. Like, and if you didn't check an email or you didn't respond to a professor soon enough, you would get chewed up. Chewed out for that. Like,
Mm-hmm.
if you answered the next morning instead of the night that emailed you at 12 o'clock at night,
Mhm.
you'd be in trouble.
Mm.
So I would wake up in a panic, in a cold sweat, checking my damn email. So now I realize that actually it came to my attention yesterday. I cannot sit still anymore. I used to
I
be
feel
able to
like I
sit
can't
still.
either.
I have to be doing work.
Mhm.
So I've had to make myself do self-care things because I start to feel guilty when I'm not working on something. And that came from being in grad school where I had to
Mhm.
do work all the time.
That's
So
crazy.
that's my only experience where I'm like, hey, is this anxiety? Like, and it is anxiety, but it's not clinical because it hasn't messed up my functioning,
Right.
Mhm.
but it's still anxiety.
Mm-hmm.
Where I have become this person where I'm just like, no, listen, let me tell you, there's not an email that's not read on my phone. And
Right.
I don't know how many emails a day. So I just became this very anal person in a sense of like work things. Not my general personality, but yeah, that's my only experience where I'm like, this is affecting my emotional health.
Okay.
And how would you describe like the character traits of someone that is clinically diagnosed with anxiety? Like,
So you wouldn't call it a character. You have people that personality wise they're just anxious, but if it's clinical anxiety, like generalized anxiety, there's different types of anxiety. But
mhm.
for generalized anxiety, you wouldn't call it a character trait because it's not necessarily their personality, it's symptoms of something they're going through that could have been triggered by a number of things. So a person that's anxious is usually has worries or preoccupations about something, like a lot of worried thoughts,
Mm.
um, where it's distracting almost. And
Mm-hmm.
they can, or not almost, it is distracting. They can develop like avoidant behavior. So whatever is making them anxious, they may start to avoid it
Mm-hmm.
to a point where it messes up their functioning. So maybe I'm not going to work because I got so anxious about something happening. I'm so anxious about driving or something like that that I'm not going to get in the car and go to work that day.
Right.
And then now I'm taking off 3 days a week.
Mm-hmm.
Things like that. So it's nervousness, it's preoccupation with thoughts, it's avoidant behaviors, and to where it affects your functioning.
Mm-hmm. And sometimes it's not even a realistic.
Yeah, a lot of times it's not
Yeah,
realistic
like
thoughts because the thoughts escalate.
It'll just be crazy. Like people always feel like they have anxiety, but when you work with people who have real anxiety,
It's
like people who
different.
can't, like they don't, I can't leave my house because I just feel like something bad's gonna happen. Well, what's bad's gonna happen, and why do you think something bad? They don't know. I don't know. I
Oh.
can't tell you. I don't know what I think is gonna happen. I don't know why I think something's gonna happen. I just feel like something's gonna happen, and they
Mhm.
literally won't leave their house.
Mm.
Won't leave their
And
house
they
to get
become,
food,
yeah, they
and
become hyper vigilant, like
mhm.
trying
Oh
to
yeah,
control things around them,
that they
hyper
cannot control.
aroused.
Mm-hmm.
So just things that wouldn't trigger the normal person, they're paying
Mm.
attention to, and a lot of attention to it, and they're trying to control their environment to make themselves feel safer, even though they really don't have control over the things they're trying to
Right.
control.
I have one thing. Oh, you guys can answer this because this is a about you say like, okay, today they're happy, nice, and tomorrow. And like when I was in Psych 101, like the way they describe bipolar is like way different than how people
Yeah,
are
there's a
really.
difference between clinical bipolar and what
Bipolar disorder
people talk about.
literally used to be manic depression.
Mm-hmm.
And so it means that at times you have depressive symptoms, and at other times you have manic symptoms, and you cycle through depression and manic symptoms. That's what bipolar is.
Mm-hmm.
So it's the symptoms of depression, and then it's mania, which is like impulsive behavior, sleeplessness.
Mm-hmm.
Um, it could be a high like euphoria, like
Mm-hmm.
really elevated happiness, or it can be just like it could be like a person that you think of that is like, you know what, I'm gonna do work all night until the next night. I'm gonna work for 3 days, and then I'm gonna go shopping, and then I'm gonna have sex with a bunch of, it's
They're
like,
super productive.
right, super like
And a lot of
hyper-focused and
people who
getting a
have
lot
mania,
done.
they like it because when they're in that manic episode, they get so much done and they're so happy and they're on this high and they're productive and they're
Yes,
like all over
it's
the
a
place
high.
and they're just like, I don't like, they'll come to me like, but I like my mania, but you're not
Yes.
sleeping and you're spending all your money.
Oh.
So
So
bipolar is high, really high highs and really low lows. That's what bipolar disorder is.
but
People call people bipolar like if a person,
it's
they think
moody.
a person has mood,
Yeah,
is
they
Mm-hmm.
moody
do.
or
Yeah,
has
I hear
mood
this.
swings. But
Yeah.
no, bipolar disorder is very serious,
Mm-hmm.
because think of a person that feels very hopeless and sad at other times to where they can't get out the bed, and then other times they can't sit still.
Mm-hmm.
They think that they can do anything and everything. They don't need to sleep, they don't need to eat,
Oh
Mm-hmm.
they
wow.
can just do whatever they want because they
Mm-hmm.
feel so good,
Mm-hmm.
Yeah.
and it's not leveled. So you can't
Oh.
function like that. Like, I'm not gonna go to work today. Today feels good. I'm gonna go. It's just like. And then other days, like, I can't go to work because I just can't get out the bed. I can't
Mm-hmm.
do
Oh
it.
wow.
Yeah. So when we talk about it, like, regular vernacular
Yeah, it's
conversation, they're
not.
like, oh, she bipolar. One minute she happy, next minute she's sad. Like
But that's not the same
they
thing.
think of somebody who's moody. So again, like when we talk about depression and anxiety and stuff like that, it's like there's always two ways to look at it for like me, because I'm always like conversationally bipolar or for real bipolar, because that's two
Same
different
thing as
things.
depressed,
Same thing
anxious,
as
and all of
depressed,
that. Yeah,
right? When
we
people tell
use
me they're
things in a
depressed, I'm
vernacular
like,
that don't really mean what they mean clinically.
how depressed are you really?
Yeah. So
Let me
it's a
get an idea.
clinical. It's a clinical part, and then it's just like you.
Exactly. Most people, when they say bipolar, they don't mean somebody who's going back and forth between mania and depression. They're talking about somebody who's moody.
Mm-hmm. Yeah, that's
Right,
what
which, and
mostly.
people use it as an insult,
Yeah.
Yeah.
like, "Oh, you're bipolar." That's not what you do. That's stigmatism as well. Like,
Mhm.
so yeah, people use it like, with her bipolar ass. Like, you know
Right.
what I'm saying? Like, no, we don't do that. No, like, don't say that. Yeah, like it's serious. You know who I love who has bipolar disorder, and she's very open about it? The actress from Blackish, that sings the songs with Brandy sometimes. Her
Yes,
name is
her.
not
She is
coming to me.
bipolar.
Who?
Yes.
The
Um,
lady. She's in
she's the
that a lot of.
grandmother on
She has
Blackish.
bipolar schizophrenia.
Yeah, she does. She's
She's been in a
bipolar.
lot of
That
things, but
sings
that's
with
the
Brandy.
thing that she's in most recent.
You seen her? She
Um,
always be
most
doing
recently.
like lives with Brandy, and they be
The
singing.
grandmom.
You
from
know who
Blackish.
she is. She played in a lot of movies.
She's
Um,
the mom on
Remember the
What's
movie The
Love Got to
Cookout?
Do with It. She plays Angela Bassett's mom. She's one of the sisters on
I
the
think I know who
Fresh
you're
Prince
talking
of
about.
Bel
All
Air.
right, I know who you're
She's in
talking
a
about.
lot of
Yeah,
I
yeah,
think
I
yeah.
didn't know that she was bipolar.
Yeah, she is. She is.
Oh.
She talked about on the
But she
Breakfast Club.
says also that she had Tourette's too.
T-Rex.
well,
Yeah.
yeah, you can have comorbid disorders. A lot of disorders
Oh
have to
wow.
do with your brain.
My best example of bipolar is Mariah Carey.
She
Judge is bipolar. She bipolar as hell.
sound like her diagnosis. She said she had bipolar
Jennifer
disorder.
Lewis.
Jennifer
Mariah
Lewis.
Carey, you can't
Jennifer
tell me
Lewis.
Mariah Carey don't got bipolar disorder.
No, I don't. I try not to. I don't try to get.
You can't convince
Oh my
me.
God! You know what just came to my mind? We're way past this. Just the other night, some guy that asked me out just told me all his PTSD stuff
Oh
out
my
of
God.
nowhere.
See,
Anyway,
that's the shit I don't like.
Really?
Don't ask to take me on a date and you want me to be a therapist. That's gonna piss me
So
off.
is that so?
yeah, he was asking for my number, and he was like, I got shot 8 times.
Oh
He
wow.
was a bouncer. He was a bouncer, but that's not why he got shot. He said I got shot randomly 8 times, and I have PTSD. And he was showing
Ooh.
me his injuries, and he's like, I have PTSD, and it's not that I wouldn't date someone with PTSD,
D.
but sir, I just met you 4 seconds ago.
Right.
Yeah, something's wrong.
Like, why
Right. When people find out you're a therapist, they will tell you everything. And I'm just like, right.
Yeah.
Are you gonna
word.
pay
That's
me?
crazy. But you know what? The type of person I am, like, I don't mind at all. Like, I actually like that people feel like they can talk to me about everything. But I'm not gonna lie. Sometimes I'd be like, listen, I gotta do this all day long. Can we talk about something happy?
Oh, okay.
Like, I'm
Mhm.
exhausted, like mentally. Sometimes I'm just like, I don't want to deal with you and your emotions today. And I just need you to understand that.
The
I'm not a
PTSD
therapist,
is
and I'd be not wanting to deal with people.
People think that they can just always talk to you about that kind of stuff because you're a therapist.
I
yeah,
be
but
feeling
it's
like
not.
I got my own emotions that weigh real heavy on me. I can't take.
I
in
think I
everything.
have.
You
I
th-
think I have the talk to me sign on my forehead because people that don't know that I'm a therapist will just start telling me things.
Right. But I
And I'm
think it's
just
because
like,
I
I
think
just look like a
you give
person
off a
that
vibe.
wants to hear what's going
It's
on
the
because
vibes.
people just sit down next to me like, "Hi,
Right.
my son."
Absolutely. No, like
the
seriously,
vibes,
it has
the
to be a vibe because people do the same. Like, but I'm not mad at it. I like it when people, like, me and my friends. Sometimes we do like little gay stuff. Or I'm like, oh, what do you guys want to be remembered for? And I always like somebody you could talk to about everything, and then it reflects in my career. And people literally will just tell me
Okay.
everything, and it's super important to me to keep it private. Like, it's really, really important to me to not say
Is
anything.
it hard to do that?
No, not at all. I feel like
It-
I'm the best vault of secrets that anybody ever in this world could have. Like, if you tell me something, nobody's ever gonna find out about it unless you tell them.
the only time that it's hard, right, is when somebody tells you something, but I still wouldn't. It's just when someone tells you something that it's just the strangest thing you've ever heard, but it's your secret to keep.
Yeah.
You
Mm.
can't share it. Like it'll be something like you never imagined, you couldn't fantasize it, and someone tells you a story where you're like, what? But you
And you
cannot
Like,
be like,
oh, I want to tell somebody,
never
but I
repeat what
can't.
it is.
Uh-huh.
If
Yeah.
I hear
it's
something
just
at
like
work, I'll
and
definitely be
if you
like,
did repeat it, they would know it's their story. 'Cause it's about you.
exactly. No, like sometimes I hear stuff at my job that is so wild that I come back and I'll be like, girl, I had a client today who XYZ, and of course I leave it there. But if they ever repeated it somewhere, and then the client, like, the story would be so, like she said, the story would be so crazy that they know it's their story.
Yeah.
I'm like, you
But
will
yes, you
never
just
believe
don't.
this.
Is that
That's why
hard?
people tell you their secrets because they know that you're not going to tell.
Right.
Oh, okay.
So that's the best. If I know that you cannot, ethically, you cannot tell anyone,
Mhm.
then I can
Legally.
tell you all kinds of things that I never felt comfortable telling anybody.
Right.
Because there's no repercussion for it. My family won't know. My
Mhm.
husband won't know. My wife won't know.
And
And I can tell you that I did these things or these things happened to me, and I don't have to worry about people finding out.
right.
How do you cope with that? I think that would be hard to have all these secrets bottled up in you. Like,
It's not like that.
I
It's not.
yeah.
It's not like they bottle. It's not like I'm working hard to keep the secret. This is why you don't work with people that you know. Like, a lot of my friends will be like, oh, can you help? Can you do some therapy with my kids? Or can you do? Oh, so many people ask me to do couples counseling with them and their boyfriend. Listen, okay, I know you. So
can't.
when I know somebody and I'm bottling up all these secrets of people that I know and people
Yeah.
that I have mutual friends with, that's harder than people I don't
Yeah,
know
that's what I mean.
personally.
So
So
in
I
your
won't
friendship, you
work
don't
with
work with friends.
hell no. Like I'll definitely like listen to them and I don't give advice. I'll give you perspective. Like, okay, well, ask yourself these questions. You don't have to answer them. I'm going to ask you questions and I want you to ask yourself
those questions.
and blah 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 whatever. I'm not giving you no advice, but a lot of my friends
Yes,
always
we're not
ask me,
advice givers.
right,
And that's what people think. We're not advice givers.
how you gonna tell me? I'm
We're
not telling you how to do
there to
anything.
help you process what's going on with you so that you
Come up
can
with
make
your own
decisions for
decision.
yourself.
Right.
And we're going to guide you
Right.
through that. But we don't make decisions for you because we're not the ones that live with the consequences of the decisions
Exactly.
that you make.
Okay.
So it's not for us, and that's why we don't work with people that we know because we don't want to be biased. My job
Right.
is your agenda. So what are you here for? This is what you want to
Exactly.
work on? Okay, so you give me the map and
Mhm.
I'm in the car with you and I'm reading the map to you. And when you get off
Right.
course, I'm like, hey, we're
Tell me where
course,
you
we're
want to
off
go and I'll
course.
get you there.
We need to do this to get back on track
Right.
of what you said you wanted. I'm trying to get you to your destination.
Mhm.
On that map is not anything that is about me or what I would want.
Right.
You know, it has nothing to do with me.
And that's why you can't work with your friends because I got my own expectations, feelings. I got my own opinions. I got my own bias. I know stuff about, and then you're not going to be honest with me. You're not going to be as honest with me as you would be with a stranger. One of
And
my
I
friends
can't
was
be as
like, "Oh,
honest
can
with
you
you
do?"
because I don't want to hurt your feelings and
Right.
lose you. I can't.
Exactly.
There's certain things
it's
I
a
can
conflict.
say.
One of my friends was like, you think you can do couples counseling? Like she had been talking to me for a couple weeks about stuff she was going through. And I'm just, she's like, you think you could do couple counseling with me and my boyfriend? And I'm like, I said no, but in the back of my head, I'm like, I know he's cheating on you. Like I literally
No,
know, but it's not like I can tell her. Like that's why it just gets blurred. So I'm
blurry.
like, I know if I do couples counseling with y'all, he's not gonna tell me anything because he knows I know he cheating.
Yeah.
So it's like,
it's
I
not-
think you
gotta
should get
do
your own
someone
therapist.
Yeah.
You can't have me because he's not gonna be honest. He's not gonna be honest with you, and then he's not gonna be honest with me because I know him.
Oh, so it's like,
You know what I
it's
mean?
just a conflict.
It's a conflict of interest, but they don't understand that. It's like,
I get it. I would rather talk to somebody I don't know, though.
right, because
In
you can be more
person.
honest with them.
Yeah, so it won't be. I won't.
You don't have to worry about them telling anybody else your business.
Yeah, that's why.
And even if I didn't have an agenda, if I already know you, you're going to think I have an agenda based on what you know about me.
Exactly.
Yeah, so
it just doesn't work that way, and which is why we don't see people that we know.
Yeah.
What about the PTSD though? It's a lot of men with that.
There's a lot of people with PTSD, not just men.
Do you deal with military? A lot of military men? Well,
I have not. I only have worked with some people in the military. I've never worked at a VA or like places where a lot of military people seek help.
Mm-hmm.
But people in the military are not the only people walking around with PTSD.
Mm-hmm. People think PTSD and they automatically go to military.
Yeah,
for so long that's the only population of people they recognize with it. But there's people literally walking around with PTSD and they don't even know that they're showing symptoms of the nightmares and the flashbacks and the overvigilance and all of that stuff. There's all symptoms of PTSD. Mm-hmm. And if you grow up in a bad neighborhood, you probably suffer from some type of PTSD.
Yes, PTSD is basically any person that we all suffer traumas, first of all, mm-hmm. but it's a trauma that affects you in a particular way. And so a trauma is an experience where you feel unsafe. And it doesn't even have to be your experience. Someone can come and tell you something that happened to them. And if then it makes you feel unsafe, you can develop PTSD from that. People develop PTSD from watching the towers go down on TV. Mm-hmm. And they weren't there, but they had PTSD from seeing it or seeing things happen on the news. Mm-hmm. So it's a lot of people walking around with it could be sexual trauma, mm-hmm. it could be violence. It could be anything,
which is the most I've seen that more than anything else. The
is
sexual
phobia connected to it? Phobia.
Phobia is a type of anxiety. It's specific. Oh, okay. So if I have a phobia, I have a specific anxiety to a particular thing, like spiders or airplanes.
I do to deers.
I
have a phobia for deers. Like if I see there's 541. In Burlington, I literally was in the middle of 541 and I reversed the car all the way back because I seen the deer. Like, in the middle of the street,
jump up on your car and stuff. So that can be scary because deer can you make me say deers.
With the did a deer do to
It
you?
cannot damage your
Somebody,
car.
like what she said, connected to what you said, when somebody tell you, somebody had told me a story when I was younger about a deer hitting their car, and the deer head was in their face. So
Yeah,
ever since then, it's traumatized me. So I am
yeah.
scared of deer, like to the
You
T.
you can be scared of deer from a story. Yes, you can. It
It
sounds
sounds
funny.
crazy, but
It
it,
And
does,
the first thing
but
that came to my mind was, well, just watch Bambi. But no, it's serious. If you have a trauma, where you can't drive certain places. So now it doesn't really affect you if you just don't drive down certain roads. But imagine if you were like, you know what? No, I'm not getting in the car because I live in a suburb and it's only deer around
Mhm.
here. I'm not going to work anymore because of it.
Right.
Mhm.
You know what I'm saying? Or I'm not
Yeah.
going to my child's event because of it. That's when it's like a phobia.
Yeah.
It's affecting your functioning to a real degree. Like
Yeah.
it has real consequences on your life.
Yeah, I have did detours and stuff just to avoid deers.
And avoidance. So we
Like,
remember we said part of anxiety is
mhm.
avoidance of things that scare you.
Mhm.
So yeah, when you're like, you know what, I'm not doing that because I'm afraid or I'm worried about what could happen because of XYZ.
Mhm.
Mhm.
Yeah.
That's crazy. It sounds crazy, but yeah, I have a phobia for that.
No, but
Bad.
it's so. And if you came in to see someone, they would take you seriously if you said, you know what,
Deer.
I'm afraid of deer
I don't
because
like
my cousin
deer.
told me this. Now when it's a lot of deer in my neighborhood, I feel this
I need to
way when I'm
move.
driving. I can't do XYZ because of it.
Mhm.
They would take you seriously and they would treat you. They would probably give you like exposure therapy.
Oh, I
Oh,
hate exposure therapy. I think it's
I
so
love
cruel.
exposure therapy.
You
really?
hate deer?
I
Well, let's go
love
see a pack of
exposure.
deer.
I did. I went to Mill Creek Park. You know that. I went through Mill Creek Park, and it was a whole, oh my God, I almost
Family.
whole
had a heart
family.
attack. Like I literally had I was about to have a heart attack.
Meanwhile,
That
I'm the
was,
type to walk up on them and take pictures. Like,
yeah,
oh,
no,
You're gonna get kicked in your face.
nah. I seen this little baby was like, I need some leaves. I took a picture
Aw.
of it, and then I realized that there was like 5
family
deers
members.
in the background. I was like, oh, I'm out.
Yeah,
I'm
no,
out
no,
of
no.
here. I ain't got time for that.
I was almost had a heart attack. No.
I love exposure.
Oh, so
Because
that's the
in my
exposure.
experience, it works.
Oh, okay.
For particular things, in anxiety, it works. For some
Mm.
things, it doesn't work.
What
So,
about
but I like
OC?
I love exposure.
What about OCD?
OCD is another form of anxiety, and it's specific. It's
Mm-hmm.
not just it's neurological at times too.
Oh, okay.
So you start to fixate and worry about something in a unrealistic way, and then you try to control it.
Mm-hmm.
So you either try to avoid it or you try to control it to a degree that's not realistic. You
You
can't
could.
control it. So like a person that's washing their hands however many times a day to avoid germs. You cannot avoid all germs. It's impossible. But not only that, if you're washing your hands that many times a day, now you're making your skin raw and
Raw.
open to infection.
Mm-hmm.
Yeah.
So, and okay, so then it's like, at first, I'm not going to shake hands. But you know what? Now I'm not going to touch anything that someone else has touched.
Mm-hmm.
So now I'm not even
Oh,
going to
yeah.
touch the things that I've touched just in case I had germs before when I
Right.
touched them. Now I'm going to walk around with hand sanitizer and wipes. And every time I touch anything, I'm going
Gloves.
to wash my hands. Matter of fact, let me just put gloves
Mm-hmm.
on my hands.
Matter of fact,
And
let
if
me
your
walk
kid's
around
like,
in a bubble.
Mommy,
That's the
why are you
worst
walking
too.
around
That
with
can
gloves? You don't,
hold
or
bacteria
your
and
husband is
shit.
like, you don't touch me anymore. Oh, because you're germy. I can't touch you.
Really? It's
You got
like
Yeah.
that?
cooties.
Really? Can
Yeah.
kids suffer from OCD?
Yeah.
Yeah.
Kids can suffer from OCD.
I feel like my son got a little bit. Like
A little bit.
he won't go to bed unless the light is a certain way. Like he can't sleep. And I'm like,
So it
huh?
was just like that, the way we use depressed and sad, like he would have to be diagnosed with there's certain symptoms. So I haven't been telling you the symptoms of things because any symptoms that you want to know for a disorder, you can just look up. I've been trying to give you examples of what it looks like
Like,
when a person has it.
mm-hmm.
But if you look up the symptoms of OCD and you feel like, okay, he has this, maybe I should take him to the doctor. But if he just wants to light a certain way before he is being particular about something and it's not that big of a deal, then he
It's not.
probably doesn't have OCD.
Yeah, it has to be
Um,
extreme. Like the guy from that show Deal or No Deal. He has OCD. Like
the
he
actor
doesn't,
you're talking about
yeah, he
with the
doesn't
bald head.
he
Yeah.
doesn't shape it.
Wayne
Shape.
Brady.
No, not Wayne
How,
Brady.
uh,
Oh,
how,
he is on the show with Wayne Brady. That
Deal
guy.
or no deal?
Yeah.
He is black, right?
No, it was a
no,
guy
he's
before
white.
him.
Uh,
But he wouldn't shake people's hand. Like in the acting world and whatever, because he has it really bad.
I think, yeah.
They talked about
There's a
him.
lot of celebrities with mental health disorders, like with
Mm-hmm.
anxiety, depression, and they're talking about it more now to encourage people to get help, to take away the stigmatism. So that's changing. I think you had a question about, are like certain mental health illnesses increasing, or
Yes. Mm-hmm.
is it awareness? And I think it could, we won't know. It could be both.
Yeah, I think it's a little bit of both.
Um, of course, when awareness increases for something, people will identify it more.
Mm-hmm.
But could people's mental health disorders be increasing? Yeah, because it always depends. It's contextual too. It's
Mm-hmm.
nature versus nurture.
Okay.
Where whatever's going on, like think about how people could be traumatized right now by the political environment.
That's exactly the example I was going to bring up.
Yeah, so depending on what's going on in the world, you can disorder.
Oh, okay. Ooh.
Um,
So it probably will run.
And a lot of people are
like substance
self-medicating.
abuse right now with opioids, how
Right.
that's
Yeah.
increasing.
People are
So
self-medicating because they're feeling all of these anxieties and depression, and they try to numb it as opposed to dealing with it. So you get a lot of substance abuse because it's a quick fix. Well, it doesn't fix
and people
anything, it just
have
numbs you.
had access to these pills for some time.
Mm-hmm.
And that's another environmental thing that increased the use of these substances.
Mm-hmm.
And then
So, and you can have
culturally in our
trauma. You can
music,
have a lot of trauma right now due to the political environment. Like you have people that
Yeah.
are anxious about being deported. You have people that are just anxious about racism,
mm-hmm.
um, or going through traumatic experience from people doing racist things to them.
Mm-hmm.
So, like, yeah, a disorder can increase depending on upon the environment.
Black men, for instance, like, well, not even black men, black people, just a regular traffic stop is anxiety provoking for them because you
Yeah.
never know how that shit gonna turn out.
Yeah.
You never know. And then, like I was saying with the music, like, we have all of these songs that kind of promote drug use, but it's like I never understood, and it's probably because I'm a drug and alcohol therapist, but I never understand when I hear all of these songs about these rappers talking about how many perks and and
crazy.
Because they
lean
haven't been
I'm
on the
like,
side of not
why are
having
you
money,
bragging about this? This is crazy.
because
Are you
they
proud of
haven't been
this?
on the other side of not having money for pills, and then because you don't have enough money to buy pills, now you're using heroin.
Right.
Because they're not on that side of it yet, so it's still cute to them
That's
and
not
it's
cute.
fun to them because they don't really understand what they're doing to themselves.
Right. That shit is just so scary for me. Like, even when I hear people kind of like, celebrating, like, oh, we about to get this. And I'm like, you want to do what? Like, you might as well just said you about to shoot heroin in your veins, because that's how I'm looking at you right now. Because I just don't understand
Yeah.
why you
And
think.
like half the rappers that be really talking about it don't even be about it.
I don't know. They
I
look
don't
like
The
they
know.
thing
are.
about drugs, though, is that because it works on your dopamine center and other neurotransmitters, it feels good.
Yeah.
So that's why people,
Pleasure
you know,
principle.
what you know, that's why people glorify it. But
Mhm.
at the same time, like you're glorifying temporary gratification. You're not thinking about the long term consequences of what you're doing or the message that you're sending to
Mhm.
other people following you. So. And I
Right.
think people don't tell kids that enough. Like we tell kids don't do drugs, but we don't really explain that people
Why?
do drugs because in the moment it feels good.
Good.
Mhm.
Yeah.
You
But
got to be
that
honest
good
about it.
feeling doesn't last, and then as a result, you have all these other consequences. Same thing for sex. We don't really tell kids sex feels good, but if you do it, then X, Y, Z can happen. We just try to scare them from
Yeah.
having.
Mm-hmm.
You got to be honest about it.
You do have to be honest, because I noticed being honest
That was
will
part
make
of
them
my
more aware.
curiosity about it.
Yeah, that's why they're curious. Like,
Because
well,
I'm
why
like,
so
well, why are you doing it?
exactly?
Well, why you keep doing it?
Right.
But why?
But if you
why?
tell them why, like this is the consequences, it might
But
register
people don't
different.
understand how quickly you can become dependent on certain things. You know what I mean? Like alcohol. Alcohol works so quick in the way that you can drink, right? And then you're hungover the next day. But what do you think that hangover is? That hangover is your body reacting to not having alcohol in it after having so much alcohol in it. It's that quick, right? So if you're doing this every day, you're building this habit in your body, like you're building a dependency. And look how quick that, and because alcohol is legal, it's like it's one of the scariest ones. That's a withdrawal that you can literally die from. You cannot withdraw from alcohol without medical assistance because you could die, right?
Mhm.
But it's legal and everybody does it and we glorify it. Like when you have friends that drink every day, you're not like, oh, haha, you're an alcoholic. That shit's not funny.
Yeah,
No,
it's not funny. It's
seriously,
not funny.
you need to slow down.
Yeah.
Right? But we literally have friends that we know. I'm sure everybody in this room knows somebody that drinks every day.
Yeah.
At least once every day. But nobody's going to that person like, are you all right?
It's hard to go to
I
that
do
person.
when I go to them and ask them if they're already all right.
Right. How do you feel when you're not drinking?
I try to talk people into getting help, but
Right.
people are going to do what they
Want
want to do
because they
until
don't think
they're
they have a
ready
problem.
for change.
Because when people think about an alcoholic, they're thinking about the person who sleep outside of the liquor store who don't have a job. But if you have a job and you got relationships and you're not sleep outside of the liquor store and you're taking care of yourself, you're not an alcoholic. But guess what? Every alcoholic don't start sleep in front of the liquor store. Every alcoholic starts like drinking every single day.
User don't start with heroin.
They don't start with heroin. I don't know a lot of people who started with heroin.
Does not look like what you see on TV where they're living outside. I mean, that's the end result.
That's the end result.
But it doesn't start off that way. It starts off as a lot of fun. Like just I'm partying. I'm having a good time.
People don't see it like that.
Right. And when you're not drinking, I always ask them questions like, how do you feel? Because you're irritated because you need a drink. But guess what that is? Like all of this stuff is dependencies. All of this stuff is withdrawal. You don't even know. I can't sleep unless I drink. What do you think that is? Like your body will communicate with you and tell you, like, what do you think that is? And you think it's, oh, well, let me just have a drink. Okay, go ahead. Keep having a drink because your body tells you need a drink and see where that gets you. Yeah. People keep playing around with it. It's not a game. It is not
I'll be like,
a game.
Let me just send you where this therapist is. Where you live?
It's scary though.
I'm that annoying ass person.
I know. I have so many friends who I really think they have drug and alcohol problems, but I can't tell them, especially because I'm a therapist. Because they just, oh, here you go. Yeah. I'm not paying you. Why are you trying to? I'm trying to help you. Like I'm telling you that you got a problem.
I'll let them know. Like I won't come out here like I think you're an alcoholic or I think you're this. If they don't already know it, I would ask them. Like I talk to people I care about that go through their own issues. Like, how are you feeling? How have you been doing? Mm-hmm. What have you been doing to feel better? Is it working? Is it not? Mm-hmm. Do you want any? Sometimes, because I had to learn to ask people, do they want suggestions? Friends and family. I don't go around telling people. I don't go around diagnosing people or giving people suggestions. But people that I care about,
right.
who I want them to be, at their best and feeling good. If I feel like things are bothering them or they're going through something, I used to just suggest things. Mm-hmm. Then I had to learn, like, let me ask them, do they even want my input?
Very important. I had to learn that too.
Yeah, because everybody doesn't want your answers, even if you went to school forever to be able to help. They're like, my family is still like, doctor, what? Anyway, nobody's listening to it.
Right. One of my friends was like, what did she say?
That kills me. My family comes back to me with these books they read, telling me the same thing I told them 2 years ago.
Right, because if it comes from you, it don't matter. It has to come from somebody else.
Right. This is why you can't work with people you know.
Exactly.
Yeah.
When I had gotten into an argument with one of my friends once, and she was like, why do you think you always got to be the person to tell somebody about themselves? Like, who designated you the person to tell everybody about themselves?
It's a feisty trait.
And in that moment, like, we're just going back and forth. And I'm like, I'm not going to lie to you. If I see something, I'm going to, like, you're my friend. I'm not going to lie to you. But in retrospect, thinking back to that, I had to check myself. You know what I mean? And that's growth. We have to take criticism constructively, even in the heat of the moment. I don't
even want your input on my hairstyle.
So exactly.
I'm not about to go around telling you about your real life.
So I had to learn that
because if you say something about my hair, I have a problem with that.
Right. So I had to learn that if somebody didn't ask your opinion, shut the fuck up. And I've learned to do that. And I literally, my friends will sit there and talk and talk and talk, and they'd be like, "You don't got nothing to say?" Nope. Is that what you want from me?
Then I will give all the opinions that I want.
Because if you posted it, you must have wanted an opinion.
If I have something to say about what you said on Facebook,
how dare you post it and tell me to mind my business?
Right, they still be like, mind your business. I asked
Facebook
though. I'm on here.
Right. I hate that. That's a pet peeve.
Says comment right under your post.
Right. I'm gonna turn the comments off then.
What I think and feel.
Right. You fishing for attention. I'm giving it to you. You better take it.
Right.
Just because I'm saying something you ain't want to hear.
They Dr. Jazz, on the dating tip, right? Okay. Is it hard to date? Now, would you date a man? You live in Miami. Would you date a man who was a GM for McDonald's?
A GM for McDonald's? I would I am the type of person, because I'm 35 years old. Okay, it took me a long time to
Mm-hmm.
get to my. I knew this was gonna be my career 12 years ago.
Oh, okay.
It took me a long, and probably longer than that, but as far as going to school, it's been a long journey, and so I have my goals in mind of what I want. If you match me on what my basically what my needs are in a partner, which I'm very clear on, thanks to, I'm gonna shout out Trevor Scott. He's a relationship coach that I've worked with, and he's worked with me personally, and then I've worked with him, like collaborated with him on
Oh,
things.
okay.
So because I had to get clear on what I was looking for in a relationship, so I'm clear on that. And so if you match those things, and
Mm-hmm.
you have a plan of, you're working on yourself, you take care of yourself, and you have plans for the future that you're working on. I really don't care what your particular job is. Can you take care of yourself? Can we build together?
Mm-hmm.
I'm not a materialistic person either.
Okay.
So like, and
That
you
that
don't have,
wouldn't phase you.
and I'm not judging anybody that wants somebody that has a certain salary, because you have to do in life what works for you and what will make your relationship work.
Mm-hmm.
But so I don't care what you are. You're the boss, or you taking care of yourself. You can take care of yourself and me.
Mm-hmm.
I don't care what your job is. I won't say I don't care what your job is. I met a guy who ran houses that house pedophiles. Now you think about it, they need somewhere to live, right? But I
Mm-hmm.
just can't date you based on that. Like, my husband can't be the one that's giving them places to live.
Have you
You know
ever
what I'm
had to
saying?
work with a
So
pedophile?
that, something like that would bother me. But if you're the general manager of McDonald's, I don't care. Like, I'm in postdoc stage, and I'm creating my business. So I'm all about a person's, are you kind? Are you smart? How do you treat me? And then money wise, we can work that out, because
Mm-hmm.
I'm ambitious. As long as you're willing to go where I'm willing to go and do what I'm willing to do, then I don't really care
Mm-hmm.
what your job title is.
So,
But you have to have been working on yourself.
yeah.
You can't be 40 years old. You know what I'm saying? Like, you can't be 40 years old just, you know,
Mm-hmm.
working minimum wage.
Mm-mm.
What have you been doing, sir, all this time?
Sorry.
And
What have you been doing, sir?
Or something, let some of you all do things and missing things in yourself. Yeah, like, I need a person, because I'm so ambitious,
Mm-hmm.
and I don't mean that in a bad way. Like, I
That's
have
that
goals that
Capricorn.
I'm really persistent about getting what I want, work
Mm-hmm.
wise, career wise, and having what I want. So if you match me with that and the other things that I need and the way that I'm treated, I'm not really big on whatever your job, unless you're housing pedophiles. Then no, sir.
Wait,
Don't
have
do that.
you how would you know that you're dating a
He told
pedophile
me,
though? No, like
huh?
she had asked, have you ever dated
You
a
can
pedophile?
Google
No,
that.
I would
If
say,
they a
have you ever
pedophile, you
worked
can
with
Google
Oh,
that.
one?
worked with one. Oh, okay.
Yeah.
Oh, no. So as a therapist, you have to know. As a therapist, you have to know your
You have to
limits,
know what
right?
your limits are.
Oh, okay.
When you are someone's therapist, your job is to be compassionate with them. Your job is to nurture them, and kind of be loving to them, really.
Mm-hmm.
You're there to support them.
Mm-hmm.
I can't do it. If you are a pedophile, there's people out there that can work with you, and I'll direct you to them, because I do believe someone should help you.
Mm-hmm.
Yeah,
I do
but just
believe
not
that you
me.
should get help.
Mm-hmm.
I cannot be the one to do it.
They do ask you what
I,
populations you can't work with.
Oh, they
I
do.
cannot
Mm-hmm.
work with. I can't do it. I'm sorry. I don't really have that much sympathy and compassion for you. I hope that you change so that you don't hurt anyone else.
Oh, okay.
But and I hope that, I'm glad that there are people that will help them. But
Mm-hmm.
my husband won't be the one housing pedophiles. No.
Yeah, that's
Oh,
a
how
bit
is that?
weird.
Oh, I'm a clinical psychologist. Oh, what does your husband do? Oh, he houses pedophiles. No.
Yeah, that is kind of weird though.
Like, how do you feel about that?
I
Like,
know.
that
I
would
mean,
be
it's a
my
helping-
first question.
helping
if that
field,
was
right?
the
I mean,
case.
he's
Like,
helping, but it's just the
Yeah, he
title
said
of
that. Like,
somebody
oh, I'm
asking.
trying to
him?
help. They need somewhere to live, and I'm like, well, I don't care. Just put them in the I don't know, prison.
I don't know, prison. They should stay there forever.
Yeah, like,
Their house needs to be prison.
right. So no one, I haven't had any clients confess anything like that to me, or disclose, not confess, because it's not church.
Mhm.
But I haven't had any clients disclose anything like that to me. But if they did, I would just tell them, like, listen, I'm not qualified to help you. I will refer you to someone who
Else.
works. I have helped people that have been sexually abused.
Yeah, that's different.
that's
Yes,
the
it's
end of
very
it.
different.
Mm-hmm.
So I just can't. It's just I don't have the skill set in the heart
I
to
don't
do
think I
to
would
do it.
either.
what to do that, right?
I don't think I would, to be able to sit down and like, even as a
Because most pedophiles have been
civilian,
abused,
like
though,
not even like
right? Some,
Yes, yeah. Now I wouldn't say most pedophiles have been abused, but have pedophiles is there a correlation? Yes, there is. There
Mhm.
are many pedophiles that have been abused. My thing is before you do it, um,
seek help.
seek help. And I know that's not,
It's
that's
hard.
ideally speaking. And
Mhm.
it's not that I'm sorry for what happened to them, but then when you go and victimize someone else, I cannot be your therapist because I don't have enough compassion in that regard to really be able to like champion for you or advocate for you the way that I would someone else.
Mhm.
So I wouldn't even, I wouldn't take their money. I would just refer them to someone
Someone else.
who does that.
Mhm.
But dating, yeah, like I love dating too. Like I like being single. I want to be in a relationship. I'm single,
Mhm.
but I don't have issues with dating. I enjoy it, and I think that I enjoy it because of my mindset about it. But
Mhm.
I'm very clear on what I'm looking for and what's important to me and what I like, but I don't need. You know what I'm saying? Like I do need someone. I don't need someone 6 something, but I do need someone that's taller than me. I get tired of people talking about my height and things like that. But as far as jobs go, can
It's
you take care of yourself
so.
and
Hmm.
shelter, food, those things? Can we do things together?
Would it be
You know,
intimidating for a lot of guys? Do guys say it's intimidating to date you because you are a doctor? That's like, you know what I mean? Like,
prestigious.
how can I
The
approach you?
elite.
I've only had maybe a few people tell me they were intimidated by me.
Mm,
And you don't know if that's true or not. So
right.
somebody is intimidated. And
Cause
most times
game is
guys won't
game.
tell you that they feel intimidated.
Mm-hmm.
Um, I've only had a few guys, say that it's intimidating. Um, but hey, then I'm not built for you. You're not built for me.
Mm-hmm.
That's fine.
Mm-hmm.
I'm okay with that. But I don't have any issues. I don't have any issues with dating. People ask me out. Um, I go on dates. I fill people out to see if I like them or not. If
Mm-hmm.
it could go any further, and yeah, I enjoy being single. I enjoy dating.
Mm-hmm. Yeah, that stage where you now the are you gonna come back to Jersey or are you gonna stay in Miami as a practice?
I'm contracted here for some years. At the job that I took, I have a contract with them. So my private practice that's within a team of people who have run their own private practices as well. A bunch
Mm-hmm.
of therapists. It's Lotus Counseling Center, and we have 3 locations in Aventura, Brickell, and Boca Raton.
Mm-hmm.
So I'm contracted for them for 3 years. But I like Florida.
Oh,
I
you
love
do?
New Jersey. New Jersey has a special place in my heart. Always will.
But you won't be
But
coming back to do
Florida,
therapy.
I
Not
don't
at
like the
least for the
boomers
next
in
3 years.
Florida, but I like Florida.
Mm-hmm.
I like the weather. I like the beaches. I like the driving to work and seeing the palm trees. I like the clouds here, which are a little different than the ones in New Jersey. I don't know. They're called like cumulus or something. I don't know.
Hmm.
There's particular clouds here in the way that the land is flat, like you can see them with the. I like Florida,
Mm-hmm.
so I don't have any problems being here.
So you won't be coming up here to therapy.
Basically.
No
You can
time.
come visit in the summer.
That's next year.
Yeah, because I hear a lot of people say like I'm not going to therapy because I'm not going to talk my issues or to see a doctor with a white person because they can't relate to me.
Hmm.
So it's like, is it it doesn't seem I hear a lot of black people say that. Like it's
Hmm.
hard to seek therapy from a white person because they don't
Hmm.
know that our struggles.
My clients say that
So
all the time. Because
Um,
it's only me and one other therapist,
that's black.
and he's white,
Uh,
so they've refused to see him.
uh,
And I'm like, well, I can't take everybody, so because our population is black,
I
and
uh,
think
they refuse to talk to him.
it's 2 sides to that coin. One is the history again, people mistreating us and experimenting on us or just being racist in judgment and people not realizing their prejudices. Like black people get misdiagnosed more than any other group of people when they go to therapy. We get diagnosed with the more severe disorders than like say a person has depression, they'll get diagnosed with schizophrenia or bipolar disorder. And it's like they don't have that, but because of the way people view people through this lens, sometimes they don't see things because they haven't taken the time to educate themselves. Um, so I don't think the issue is race. I think the issue really, when it comes down to it, I mean, of course, To us, we think it's race. So yeah, it's like, oh, I want a black person, and I understand that. But can somebody white treat you? Yes. May you not relate to them? Yes, that's possible. But if a person takes the time to learn you as an individual and learn what their prejudices are, what their biases are, and work on that and clear that up for
It
themselves,
doesn't matter.
then yes, they can help you.
Right. It's the
But
same
I
skill.
do understand wanting to go to somebody that looks like you, which is why I took the path that I took,
Mm-hmm.
because I wanted to help people that I want to help everybody, but I especially want to help people that look like me.
Mm-hmm. Yeah, I get it. Well, you kind of you look mixed.
Oh, oh, you were talking
She
to
got
me. Yeah,
green
don't
eyes,
mention me.
nice big hair. People
Are you talking to me?
to you.
Okay. Okay. I'm not, girl. I'm about to take you through a history lesson.
Oh God.
Okay. I am black. Okay. Blackity black, black, black. I'm black and I'm
Mhm.
proud. I'm not black. I'm a mix of African American and black. That's the mix
Mhm.
that I am.
Yeah, she has green
Like
eyes.
every black person in America probably has ancestors that may not just be African.
Yeah, yeah, yeah.
But when it comes down to it,
You like
I'm
I'm
black.
black. Mm-hmm.
Yes,
Uh-huh.
Hey,
I look mixed.
You know how
There's
some
so
people be
many
like,
light skinned people with,
but you know how people are.
hazel eyes and big hair walking around that are black, and we do that to each other.
Yeah,
Or you
you
don't
don't look
look
black.
like one of us.
Yeah, that's what I'm saying.
And
I
then
know a
so
lot of
we
people
make
say,
each other others.
mm-hmm.
Oh, you're too dark. You're not attractive. You're dark. Oh, you too light, so you're not black.
Yeah. Cause I know people might say that, oh well, she ain't black, she light skinned. You know,
I
you
get
mix
that
And
what
all
you
the
mix.
time.
say,
I get that all
I
I
the
would
am
time. I
black.
had
say,
somebody actually say to me, "No, you have to have some type of white in you. Like you have to." And I'm like, deep down the line somewhere, yeah, maybe possibly, but like my mom like a caramel brown. You feel me? My dad, he light skinned, but
That doesn't mean you're
y-
still black.
yeah,
Yeah,
like
girl, the colorism in our community, that's a
it's
mental health
crazy.
issue, actually. Colorism is a racism is a mental health issue, and colorism is a mental health issue among black people,
Mm-hmm.
because we do that. We internalize the things that were done to us, and then we turn around and do it to
To
each
each
other.
other.
When
Yeah.
we really need to unite with each other, we try to make each other other.
Mm-hmm.
You're dark, so you're in that group of dark people, and you're light, so you
Yeah.
belong over there. And if you're mixed, then we don't want you to identify as either. We don't accept you either. So we have to stop. We have to stop doing that to each other.
I don't. I
Um,
feel like it's so hard in that community to
and
do.
I feel like that was like my whole high school struggle was just growing up like in an environment where it was an urban situation and I do have like brown skin. The area that I was in was really multicultural, but I'm mixed in automatically with the black crowd. But being light skinned, it's like no, you got to go over there, or like oh, you feel like you bigger than or you're more than, and it was never the case. Like I just wanted to be like chilling with my people. You feel me?
Yeah.
Like, but if I went somewhere else, I'm still black. But
Yeah.
to the black community,
You're not.
I'm light skinned.
I think that I was raised in a family that was very had black pride and awareness. I don't my I have a brother that we look more like we have our similar features as far as skin color and eye color, and then I have a sister who has light eyes but not the exact same color as my brother and myself, and her skin is darker but the same color as my father. And I have cousins. I'm black, so my
Yeah.
family is light to dark,
Mm-hmm.
and so when I step out and I hear someone and I'm away from my sister who's she's light brown, or my cousin who's brown, and I hear people talk about someone being brown skinned, I'm saying something, even though I'm light skinned. Yes, because I'm black, and you're talking about my family. You're talking about my people.
Mm-hmm.
And I don't take that. I really don't take that from black people. I don't take it from black people, and I don't take it from white people. I've had to correct white people that say you have to be mixed. You're beautiful. What does that mean?
Right.
Yeah.
So I correct everyone who walks down that line, because that's racism that's turned into colorism, and then we internalize it, and we need to stop with that, because we see where it's going, where
Yeah.
other is always more attractive.
Mm-hmm.
So it used to be light skin, light skin, light skin. That's the thing. Now, well, they don't need us now, right? So, because it's not about that. It's not. It shouldn't be about that.
No, it shouldn't.
So, yeah. I don't understand. I don't understand women that go along with that. Like, oh, I'm light, team light skin. Get out of here. I'm not.
It's like
I'm
you're
not.
black.
I'm not playing those games. Yeah, I'm black, and
All my
um,
siblings are brown skin. Like I have one, maybe he's like not so light, but not so brown. But like all my, I got four brothers, and they all brown skin. Like I'm like the eyeball out, but I don't see it as
I'm white or
I'm
I'm mixed.
right.
Yeah.
Like I just be like, oh, I'm just light as hell. I be looking for a tan. I be in the
Mm.
summertime like, oh, I'm gonna lay in the sun. You feel me? Like, but that just like a stigma for myself as well. Like, cause I want to be brown like y'all. Like, but
Mhm.
not to the point where I feel some type of way about myself.
Yeah.
But like, like I'd be like, oh, I got you see that melanin? Like
Mm-hmm.
you see it. Like I got brown, I got golden. But
Do you deal with that? I was telling her that people probably be like, oh, she's mixed. You know what I mean? Like that whole I'm light skinned, you're mixed, you're not all black.
So annoying. Oh my god, it's so annoying.
but yeah, but black is not even
A color.
at
all
all.
black.
I've never seen a
Like what?
black person.
Yeah, that's the
Like
thing.
this
It's
Mike
weird.
is black.
I've seen a black person.
I've never like I don't know if I
No, I'm just saying like black is not really even an race. It's just it's when we say black, we're talking about ethnicity as well.
Yeah, exactly.
Yeah.
Like it's culture. It is
Yeah.
it's genes and it's culture. It's ancestry. It's history. But we should know by now how many variations of skin, hair, and eyes we have. Like if you don't know by now, everybody has smartphones.
It's just
Like you
willful
should
ignorance.
know that black people come in so many different colors
blonde hair,
and
blue eyes.
textures and yes, we're just so beautiful. Like
Yeah.
stop trying to divide and conquer.
Yeah. Yeah, I've always found that annoying. Like, like you were saying when I was walking in here, like it's always been a thing. It's like, you know, when you go around people who aren't black, any other culture, race, or whatever is not black, you are black. But when you get around black people, you're light skinned.
Yeah.
And then it's always a joke. Like, God forbid I say something about being black. You're not even black though.
Right.
It makes me, it's so annoying.
I'm like, damn.
And it's like at this point, I'm
you
just
tested
used
my
to
whole
it.
character.
Yeah, at this point, I'm just used to it, so I don't be all sensitive. But on some level, it's just like, yo,
I'm black.
why do I have to prove how black
Black
I
I
am?
am.
Like, why do I
Check
have
them
to
like
do
check
that?
them. Every
I'm walking around checking
denomination,
people
though,
all the
like-
time about my skin color.
It'd
I
be
check them all the time.
That's
be
the
annoying.
crazy
I don't
part.
The white
understand
folks be
it.
like,
I think
oh,
people
so
need
like
to
what type
learn.
of white you got in you? Like you gotta like, is it Russian? Is it
And
Irish?
she said the same
like
because of
is
your
it,
eyes. Yeah.
Is it? And I'm
But
like,
that's weird.
half the time people don't even really know the depths of what you do have in you. Like you do be mixed up, but sometimes you're really not. You may
Yeah.
not be. It may not be
But it
even
don't.
white.
I
That's
think
in
people
you.
define
Like,
you by color though. They just
Definitely,
do.
we do define people based on physical characteristics. That's true. But we should also have the understanding
Mhm.
culturally and ethnically that we are a diverse people when it comes to
Yeah.
appearance.
Mm-hmm.
And we should not be separated telling somebody they're not black because they're this, or telling somebody they're too dark.
Mm-hmm.
Like what is stuff like that where it's just like why?
Why? Yeah.
And then it makes me for me it's just I see where you are mentally.
Mm-hmm.
I mean, I think maybe I look at it that way. I was raised in a family where we don't do that. I didn't realize that was a thing until outside of my house because there is no light skin, dark skin conversations. We are all like,
The same.
I didn't have that. We had black pride. That's it. There's no colorism in my family.
Mm-hmm.
I didn't go through that like aunts and uncles, saying, "Oh, you're beautiful because you're light, and your sister is this because she's brown."
Mhm.
We didn't experience that.
Mm-hmm.
So I'm not having it like from white people or black people. I will tell you real quick, if you come to me with that, you're not black, you're this, you're that.
I didn't experience it till I moved to Willenboro.
Really?
Huh?
My
you
cousin,
say?
my
I
one of
said
my
I never experienced it until I moved to Willenboro.
that's crazy. My cousin, she's light. She's real light skinned. She has like nice gray hair, whatever. My other cousin, they're sisters. She's real dark skinned. She, yeah, but that's what people
Nice braided
say.
hair.
That's what people say,
Nice
right?
braided hair.
They say, "Oh, you're light skinned with the nice gray hair." Then her sister's real dark skin, and they tell her, and we've been going through this since they were little, like, oh, y'all not related. Cause why is your sister light skinned with nice gray hair, and why are you dark? And my cousin that's dark skinned, she does have a complex that's real bad. So it's
I
like
bet.
she doesn't love herself completely. She sees more love in her sister because of
That's
the
years of
complexion.
trauma.
that
Yeah.
other people put on them.
It's just
Right.
sad.
Whereas though I have a light skinned daughter and I have a brown skinned daughter. She's not like chocolate, but she's brown skinned, And my brown skinned daughter has a nice gray hair. My light skinned daughter,
What is a nice braid of hair?
quote unquote a nice braid of hair, like
what
it's
they say,
manageable. It's it's manageable, holds moisture, it shines, whatever.
I know. So that's what I'm saying. We have to change our language.
Yeah.
Because even when we identify someone's hair, because it's a particular texture, as nice.
That's crazy. My daughter, people will come up to me and say, "What's your daughter mixed with? She got a nice braid of hair," and it's like, what? Like, you know what I mean?
And then we
how do you
repeat
come?
it. Like we repeat the things
How
that
can
other
you?
in it.
It's just weird
That
how
is true.
people do that though.
Yeah,
Like,
it
and they come to you with it, and it's like, and for instance,
Okay.
like my family's from they're immigrants. They're not from America, and I tell them like my family Spanish. They'll say, "Oh, but you look black." It's like, okay, so I have to be light skinned in order for me to say I'm Spanish. Like, it's
You
just
can't be Spanish and dark skin. What's wrong with you?
it's just crazy how I don't know how everybody
I know
It's so
for a fact that
ignorant.
there
It
is
is
brown
ignorant.
skin Spanish people are.
Yeah, but they don't. People say that. People argue
They
with
come
me
in
like,
different
you're
shades,
not,
just like
you're
you do.
not, you're black. Your family. It's like, okay, I know I'm black, but I'm just telling you, my family's from.
I feel like why
People
don't
make
people
you have
know
to
the
prove
same
it.
mix of people were pretty much everywhere on this side of the
Exactly.
world.
Like,
Taino or Native American, African, European. Those are the three, and then Asian. But even Asian sometimes that look native, like it's pretty much the same mixes of things in all the, like whether you're from Latin America or you're from the United States of America, it's really the same mix of Taino and Native American, African, European. You can like really that's what's passed down. So when people are like, oh, how can you be black or darker skinned and Hispanic or Latino, it's like, what? Like I just need you to open a book or you pull out your
Educate
phone.
yourself.
Like let
We
me
got the
just
whole world at our fingertips on these cell phones.
yeah, but people
right.
people
Like
don't
just
see it
can
as
you
that.
I just want I'm just even if you go on like Wikipedia, I don't care. But just like read something before you ask these questions. Just pull it up. Ask how a person can be black and Hispanic. And it's there for you to learn and digest. Like
Mhm.
I do have time though when people ask me questions like
She
that.
said, I do have time.
Because it's ignorance and you're spreading this colorism. And I want it to stop. So I have time when people do
Come like that.
nonsense. Like don't walk up to me calling me light skinned. It's an automatic no for you,
Mhm.
sir. No.
They
Don't
light
identify
skinned.
me by my skin
I'm
color. Oh,
black.
what's up, red? No, nothing.
Yeah, that's not. I'm black. Well, thanks,
Because
Jazz.
now I feel like you are sexualizing, like you are, you're attracted to me because of my skin color. Because I'm not into that. So when my daughter or my son comes out brown, because I have brown people in my family, what
Mhm.
kind of messages will you be sending my child? Because you're walking around talking about light skin. Get
Yeah.
out of here.
Well,
I
thanks,
don't,
Jazz, for coming through. Oh well, not coming through, but
yeah.
for joining us tonight. I
Thank you for
appreciate it.
having me.
Thanks.
Thank you for
Congratulations for I think I
getting
saw you
a
like
On your
PhD.
how old?
PhD.
I saw you like
Thank
a
you.
couple years
Thank
ago,
you.
and she said she was going to school for it, so she finally. That's that's goals.
Right.
Yes, I finished it. I
That's
know it was a while
inspiration.
ago I saw you. Last thing I want to say, stop stigmatism. Everybody needs therapy.
Everybody
Everybody
needs
needs therapy.
therapy.
Mm-hmm.
Absolutely, I agree. I be
But
trying to spread the word.
Everybody needs
but
therapy.
thank you.
I be on my Instagram every week. Therapy Thursday. Everybody come get them some therapy.
Shit,
Yes.
that's
And I mean music therapy, dance therapy, everything that people call therapy, that's good. But no,
I'm
I
a
need you to
dancer, so
go
that's my
see a
therapist.
therapist, a mental health
No,
therapist.
mental health therapy.
Yes.
That's a different.
Get
You need other
some.
therapy,
Get you
therapeutic
some.
things. Do those other therapeutic self-care things, but really see a therapist.
Mm-hmm.
Okay, I'll put the word out.
Yes,
Yeah,
please
no,
do.
we do. I need to see therapy, honestly. But
Yeah.
Yeah. Thank you for coming. Thank Nakia for coming through.
No problem.
Um,
Anytime.
mm-hmm.
Nice to
We
meet you, Nikia.
It was nice to meet you too. Sort of meet you over
All right.
the
via
lines.
phone, right? But thanks for having your conversation with us and joining us tonight. Finally.
No problem.
Yes. Fine.
And good luck on your journey.
Yes,
Thank you.
yes.
Thank you.
It only goes up from here.
Okay. Yes,
Okay.
it will. And if anybody has any other questions, you can contact me on Ask Dr. Jazz. That's my Gmail and that's my IG account.
Oh, that
Okay.
costs anything? Because I might be hitting you up.
That's fine. I welcome all questions.
Okay.
Anything?
Oh.
As at Gmail.
Yes, at
Mm-hmm.
gmail.com.
Okay.
And my IG is the same, Ask Dr. Jazz. But the clinical psychologist, I think I don't even want to get into that. As you, as she said, I'm the light skinned one with the light eye. That would be me.
But thank you.
And the hair.
And the big hair. But thanks. We out.
Okay.
All right.
All
Bye.
right. Enjoy your night.
You
Bye.
too.
It's funny seeing you sit there with not knowing anything that's going on.
He was just sitting there looking at us.
Like they laughing and shit. What they laughing at?
And then it's like when y'all laughing, looking at me, it's like type,
Awkward.
type,
Oh, when we was laughing.
yeah.
What am I talking